Hello everyone, good morning, good afternoon, and good evening. Welcome to Live It Up, the show where we explore and discuss how to take your life to that next level and beyond. We cover health, wealth, relationships, and how to create a life you absolutely love. I'm your host and coach, Fletcher Ellingson. Amy will be joining us in a bit as we talk about different types of health providers. There are MDs and PAs and nurse practitioners as well as others. She'll break it down for us what all those credentials mean and talk about the differences. But before we get to that, I want to remind you that if you have questions that you would like us to answer on or off the air, you can email them directly to me at fletcher@fletcherellingson.com. Now let's get to today's email. It says, Fletcher, a month ago, my wife and I decided to file for divorce. We have 2 kids, ages 8 and 12. The decision was mutual, but it doesn't make it any easier. I feel like I've been stabbed in the heart. I feel sick to my stomach, anxious, and profoundly sad. I can't imagine starting my life over from square one, yet here I am. Any advice? Signed, Totally Lost. All right, well, first of all, thanks for reaching out. I know it can seem scary, but it really is a sign of strength. And I hear that this is a really challenging time for you and that you feel scared and sick and unsure about how to navigate. First off, I want you to set up a structure of support. Now, what do I mean by that? I want to make sure that you're working with a coach or a counselor, and I want you to call and email your friends and family and let them know what's going on for you and share with them specifically what you shared with me, that you're feeling wounded, scared, and unsure on how to navigate all of this. And ask them specifically if they will check in with you and be your support system. Going through this alone and keeping it all inside, that's not a good idea. The second thing I want you to do is to love the heck out of your kids and let them know it has nothing to do with them. Let them know that you're going to be there for them and you're going to speak positively about your wife no matter what the circumstances are. They love their mother and don't want to have to choose sides or hear negative things about their parents. Number 3, I want you to know that you're going to get through this. So get in touch with people who have been through it. I want you to imagine a couple of years down the road after you've been divorced. It's important that you do this. I want you to see yourself a couple of years from now healthy and enjoying life, seeing yourself smiling with your kids. You're healing and you're moving on with life. It may be hard to see that now, but it will happen. And it's important that you imagine this so your mind has an idea of where it's going. What I'm saying is that even though this is a huge heartache, this is going to be also an incredible opportunity to rebuild your life. This next 6 months to a year may feel like your foundations have been absolutely demolished. It won't feel good. But again, this is your opportunity to rebuild with massive intention. This is your opportunity to know yourself better than you ever have previously. So pay attention as you go through this. Ask yourself the hard questions and take responsibility anywhere that you can. Give up blame and you take the responsibility for your marriage and for your divorce, for your life. In doing this, you empower yourself to create your life. And I know this hurts. I know it feels crushing. You see, I've been there, and I would never want to go through that again, which is why I used the experience to grow, to transform, to become more passionate. You can get through this, and not only get through it, but you can be stronger and more compassionate, wiser, more patient, more open. You can even feel more alive. Now, I'm not saying deny your emotions, rather feel them and get the lessons from them, work through them. Will it require courage? Absolutely. Vulnerability? Absolutely. That's why you're going to you'll need support and to speak to people who have gone through it. It seems dark now, but light is coming, believe me. You will get through this. So stay strong and stay in action. I believe in you. Hey everybody, welcome back to Live It Up. We're here with Amy. Hello, Amy.
Hi.
Hey, tell us what we're talking about today.
Yeah, it's been a little while since I've been on the show. So today I want to talk about medical teams and how they're changing a bit And I know a lot more patients are having the experience of seeing a non-physician provider, either as their primary care provider or someone on the medical team. So I just wanted to talk a little bit about that. I think it may make patients feel more informed and comfortable with the changes. So talking about like non-physician medical providers. And when I was researching this topic, I saw that a lot of times the term mid-level is used, which is, there's hot debate about that because that's not the preferred term by these non-physician providers. And I guess the term actually is used by the DEA, by the federal government DEA branch. And what they mean by a mid-level is any provider that's not a physician, dentist, veterinarian, or podiatrist. So actually the only place that it's officially used or has been coined that term has been with the DEA.
Okay. What is the preferred terminology?
Well, there's not really a preferred terminology. You know, some people will say advanced practitioners or non-physician providers or or you can just call everybody a provider or everybody a clinician. So there isn't really yet a term that covers it all.
Okay. Well, how is this a departure from what we've had in healthcare historically?
Yeah, so, you know, for hundreds of years, I assume, it was that, you know, mostly you see your doctor, and then it's a doctor and a nurse. And that was kind of the main little unit of people that were taking care of patients in the hospital and in the clinic. In the hospital, obviously, there were other people helping out as far as x-ray, lab, respiratory therapist, and that kind of thing. But the main person that's been responsible for a person's healthcare and doing their medications and management has been a physician. And so that's what's really changing. And then even in Chelan, just until last year, and really now even this year doing more of it, we were, like when I first moved there in 2002, you know, you have your own little suite in the clinic. You're with, you know, I had an office, 3 exam rooms, a nurse, and that was all you needed. And then things, and I'll get to it in a minute, but things have changed, and there are new things being asked of us as clinics and primary care providers, that now that's not really an option just to have the doctor and the nurse team doing it all for the patients.
And are you going to go into as to why that doesn't work anymore, or what are the changes?
Yeah, so I mean, I'll kind of combine that question or the answer with the next question as far as how things are going in Chelan. So again, other places have been doing these teams for a while on primary care, but we've just kind of come to it as of last year in 2018, where the team is going to be, in our clinic at least, there's a physician and then either a nurse practitioner and a PA, and those will be the people doing most of the, you know, doing the patient care. Mm-hmm. And then there are 3 clinical assistants, either going to be an RN, LPN, or an MA. And then there'll be a unit clerk, and the unit clerk would do more of the clerical things, make the referrals. And there are really multiple reasons for the change, or changes. One of them being that there's a lot more chronic disease. You know, when healthcare, or when the medical profession really started, it was mostly that people were otherwise pretty healthy, and healthcare was really sick care, where people came in with pneumonia, or people came in with, you know, a broken bone or a skin infection, and then you treated that issue. But now there's a lot of more chronic disease, and people are living longer, and so those illnesses, you know, like diabetes, congestive heart failure, heart disease, they do better if you have a team of people taking care of them. So
let me ask you something about that. With the team, are you seeing more people, less people, same amount of people?
Well, I myself would be seeing more people. So it also allows you to be a bit more efficient, whereas it used to be, it's still like this a little bit in Chelan, but say someone has less heartburn, it's a new problem for them. Right now, I'm the one sitting down with them and giving them the education on what to do with their diet and how to take their medication and when I'm going to see them back. But eventually, it would be that the nurse would do some of that, where then it allows the physicians to kind of, or the MA, or I'm sorry, the PA or the nurse practitioner to see the patients, and then have the nurses participate in the educational aspects of it. So right now, I'm still doing all of that, but even diabetes care, that kind of thing, eventually that's going to be partly having the nurse help with that.
And is the rest of your team, are they seeing patients while you're seeing patients? Or
Yes.
Okay.
Yeah. And another reason that there's been this change is there's been a lot more, regulatory requirements, meaning that there's this quality that we're being paid. Big healthcare organizations and clinics, hospitals are going to start being paid more and more on the quality of care that they're providing. And while it sounds good in abstract, and it's not that I disagree with it, the way that they can tell whether you're doing quality, they need to know, what are you doing?
Yeah.
And so all of those answers, how are you taking care of your patients and what kind of outcomes are they having? What do their labs look like? Are they quitting smoking when you ask them to? Are they losing weight? You then have to enter that into the computer. And so that requires, forms and programming on the computer end and then a person inputting that. It also is that each time a patient comes in, which patients I assume have noticed this, they're being asked about depression every single time, asked about smoking, asked about exercise. If they have Medicare, they'll have probably an annual wellness visit where you go through every wellness service that Medicare offers, and are you up to date with that? If you have diabetes, you should have an annual foot exam. So there's these things now, these like quality metrics that we're being asked about.
Yeah.
And it takes a lot more bodies to put it all in the computer.
So is some of your team entering that data then, or are you entering it? Or?
Yeah, so the team is entering it. I mean, we're entering it too, but it takes, so just recently our nurses were taught on how to do a pretty thorough diabetic foot exam that they're supposed to do annually. It probably takes about 15 minutes. And if you think about normally a routine office visit is about 15 to 20 minutes.
Yeah.
And so you're talking about 15 minutes just doing this foot exam. So I can't really do that because my 15 minutes is supposed to be talking to the patient and refilling medication. So it's a different delivery of care model is really how things are evolving, and it requires a team.
Well, it seems like if you have that many people caring for patients, the way you just described it, it seems like you would actually see less patients, but from what I understand, you're seeing more patients. Is that accurate?
Yeah.
Okay.
Because normally if it's just the physician and the nurse may be on the phone, she may be doing refills, she may be doing different things, how in the old model.
Yeah.
And this model, we have a team, so everyone can kind of pitch in, and if you have 2 providers and really 3 kind of nurse types, then we can move patients through a bit.
It still sounds like a lot of work. I mean,
It is a lot of work.
Yeah.
And it's a lot of change, which makes everyone a little bit, it can be stressful, because healthcare is really changing.
Yeah. Okay, well, let's talk about the 2 main non-physician providers that patients see in our area, a physician assistant and a nurse practitioner. What's the difference between those?
Yeah, so I'll first talk about a physician assistant. And they're called a PA. So you may have, I assume most people have experienced that by now. Again, when I first moved here in 2002, PAs were more mostly maybe with the surgical specialties and helped in the OR and helped afterwards. But now they're very, very common. And so to become a PA, it's a pretty straightforward educational path. You have to have a bachelor's degree, so you have 4 years of college. And then PA school itself is 2 years long. And so most of the time when you finish with PA school, then you're going to have a fair amount of on-the-job training in whatever specialty that you want to go into. So whether, again, if it's a surgical specialty, you're going to spend time and they'll kind of be grooming you and training you as they go, or say it's cardiology. So I know a lot of people at Confluence Health, I see a lot of patients are seeing the PA, say we need to get somebody in, someone urgently, the PA might see them, or for starting out with a patient, the PA might see them first. So in our state, every state's a little bit different, but in our state, a PA has to practice under a physician's license. So the physician has to read a certain percentage of the PA's medical charts, and or directly supervise or work with them in practice. So that's kind of that they have to be supervised. They can't practice solo. And I was gonna say, yeah, so like in Chelan, we have a PA in our walk-in, and as I mentioned, in Confluence Health, they use PAs quite extensively And it's really nice. Say you get out of the hospital, you need to be seen in 2 days. Well, your physician may not have those visits, so the PA schedule might be kept a little bit open, and they can see you. And then the physician is kept for maybe more of the chronic care.
Now, a patient might have a concern, like if they're seeing a PA, I'm not sure that they have the expertise or the knowledge to fully help me. How can you speak to that?
Well, I mean, there is obviously in any person that you see, no matter what their degree is, they're going to have a varying level of experience and ability. So you can't. I would not assume that because they're a PA, they're going to be less valuable. And so again, most of them have really pretty extensive physician supervision and training, and so they usually fit really well into whatever practice that they're in, and they work really closely with the providers.
Yeah, so if they don't know something, they'll go talk to the MD or whoever.
Yeah,
else.
it's definitely part of the team.
Okay, cool.
We should take a break, I think.
We should. We'll be right back, and we're going to talk a little bit about nurse practitioners.
Yep.
All right, stay with us. Hey, welcome back to Live It Up. We're talking with Amy, and we're talking about all the different types of health providers. So we left off, and we were just about to learn about what a nurse practitioner is and what they do.
Yep. So a nurse practitioner is another one of these non-physician providers that are being used a lot and have been for a long time, actually. The education and training to become a nurse practitioner is a bit more variable, meaning that people may have done it a couple different ways. But the main points are that all nurse practitioners have their 4-year bachelor degree in nursing. So they're an RN, and then they have to have 1 to 2 years of experience clinically, working as an RN, preferably in the area that they then want to go into. And then they have to get their master's degree, which is a 1 to 3 year of more training to then get their nurse practitioner in, and usually it's a nurse practitioner in a certain field. So the place that I saw it a long time ago was in the NICU and the neonatal ICU. They've had nurse practitioners for a long time there. And then they've become, more and more common in the outpatient setting, but that's one of the first places I've seen it. And in Washington State, a nurse practitioner can practice completely independently. So they don't practice under a physician's license. They can prescribe anything. They don't need a preceptor. They can be a totally independent provider. And that's so Bev Lamar, who's working with me in my team at the clinic, she's a nurse practitioner.
Okay. So they actually have quite a lot of schooling and education they go through. How much more schooling is it to become an MD?
Well, it's a lot of training, yeah.
As opposed to a nurse practitioner, because what you just said sounded like a lot of years.
Well, so as a family doctor, so you do your 4 years of undergraduate, so you get your bachelor's degree, and then you do 4 years more, so that's at year 8. So then you get your MD, and then you do a residency. So that's going to be at least 3 years. So yeah, I mean.
So you're talking about like 11 years.
11 years of actual training before you're able to go out and practice in your specialty.
Got it.
So definitely, it's the longest. Becoming an MD is, and a DO is the same training, but it's the same length of time. It's the longest formal training.
Okay. Yeah, are more people going into becoming nurse practitioners?
Yeah, I think that I think becoming a PA or nurse practitioner is less expensive than medical school. I mean, by a lot, and it takes less time, especially becoming a PA. So I think it definitely is attractive for people maybe who make that decision a little bit later in life that they'd like to be a healthcare provider. That would be an option. I think the fact that they're being used so much more now in teams is making it very attractive to be a nurse practitioner and or a PA,
okay.
Not and or a PA.
How has all this improved things, or has it improved things from your take?
I definitely think it's improved things. I think it's positive all the way around. There's a
because you had how many years of just you and your nurse?
Like 16 years.
16 years. So the team element is fairly new to you.
It's new, and I really like it. It's fun. It's nice to work with a team, and it's nice to when in the past it would have been that maybe I just had to cram people into my schedule, or they had to go see walk in, now they can see Bev, who works with me, but her schedule's a bit more open, and mostly because she's new. Eventually it may not be like that, but the plan would be to keep openings in both people's schedule. But I think that in general, there's a shortage of especially primary care physicians. So it's a great option to have PAs and nurse practitioners be part of the team. And I have not experienced any kind of, ego issues or turf concerns. I mean, everyone's just been working well together. And again, in our clinic, we've had PAs and nurse practitioners, and it's been a really positive experience.
Nice. Does this allow people to get in faster to the clinic, or is it less waiting time because you have more people on a team, so you can see more people? Yeah,
for sure. So again, we're color coding our teams. So I'm on the red team. So if you're as a patient, if I'm your primary care provider, or say Beverly is, then you're on team red, then you could see really either one of us. And so it improves access for sure. And I know that our orthopedist has a PA working with him. And again, you can get in to see the PA and he can get things started for the orthopedic surgeon. And that's what I see happen in Wenatchee as well. So say someone needs to establish care with cardiology, they can go see the PA first, they can get things started, and then have them establish care with the cardiologist. So they might see the MD once a year, but they may see the PA for more acute things during the year.
Got it. What would you say to somebody who is considering going into one of these fields? What would be your advice? Go for an MD or a nurse practitioner or a PA? I mean, what are the big differences or advantages or disadvantages from your perspective?
I feel like that's a talk for maybe like an entire show.
Mm-hmm.
So I don't know that I can really answer that well. I feel like, again, medical school is, when you go to medical school and residency, you're really diving in intensely into the pathophysiology and the biochemistry and the pharmacology, and it's like heavy science, understanding things on a really, really deep level. Is that necessary all the time? Maybe not. So I think if you're someone who wants that level of education, then I think that would, and you're young, maybe you're younger, and the debt you can handle, or you don't mind taking that on. Also, it would maybe allow you to be more flexible if you wanted to do international medicine, getting your MD. I think that the PAs, especially once you leave PA school, you have an avenue to get, mentored. The experience is amazing, where if you work with someone in that field, they do really, really well.
Mm-hmm.
And then, nurses are kind of a different animal, so you do have to be willing to work as a nurse for a couple years. And I do feel like nurses and physicians have different kind of temperaments and strengths and weaknesses. So if that's something that appeals to you to be a nurse, and then you think, gosh, I would love to take care of these patients independently and really have all the responsibility myself, then getting your master's is available to you.
Cool. All right. Well, that's good for anyone out there, kind of considering going those options. You got lots of choices, sounds like.
Yeah, and I think that I just would want to reassure everybody that the team approach it's working, it's being successful. I feel like everyone in our area is doing it very conscientiously, and I think people can trust that they're being well taken care of.
Yeah, excellent. Well, thanks for the information.
Yeah.
Interesting as always. Well, hey, we are out of time, so it's time now for you to get out there. Be a source of kindness, be a source of contribution. You have something that this world needs, and we believe in you.